I think a major priority is to keep focused on the needs of the people, for midwives to do that, for especially in these days and times where the politics are so heavy. But to keep focused on the needs of the people, not our own individual needs, and not the needs of our profession, but the needs of the people. And that means we need to talk with the people, we need to be out into the community, we need to learn the culture in any community in which we're working.
I couldn't have said it better. To be a midwife, you are going to have to sacrifice. And you need to make up your mind what it is you want to sacrifice. If you go into the present system without making serious efforts to bring change, and you're going there because it has all the benefits and the high salary, and the hospital is always going to be able to pay more money than a birth center, you are going to sacrifice everything practically everything you've learned as a student, because you are not in the midwife's place of business. So, and I think we need to prepare students and graduates so they begin to think about that, so they can make the decision, to put, no, I don't want to do the way things are doing them. I want to serve the people. I want to do what the mother wants, and so that's my concern about the future.
I think there's another thing that midwives could take the lead in, because we're working under the word perinatal. And the definition of perinatal currently is 28 weeks to the 4th week of the baby's life. There is a lot of evidence now about brain growth, which begins almost immediately with conception, and then goes all the way through to at least the 3rd or 4th year of the child's life. And we can take the lead in that. Actually, we have developed a paper seeking that midwives take the lead in that, because it's just not effective when you want to change the horrendous statistics that this country has in terms of maternal mortality and infant mortality. You're going to have to look at the whole range of time that a child is growing and its brain is developing, and there is a lot of evidence for it. So I was brought up in a period where the demonstration project was the important thing, and then somebody could collect information on it and prove it, or do the evidence base. But if you don't do the demonstration, there's nothing on which to collect the information. So I think the thing that the midwives can do in their particular place of birth is look at changing that and using the evidence that there is for that to show our friends and colleagues and our, how can you say it, our co-workers in the field of maternal and infant care that this is something that we've just bypassed, we've overlooked completely, that our definition of perinatal is just absolutely outmoded.
Yeah, I couldn't agree with you more. And it also followed the money. It is what it is, because that's all they're getting paid for. And we can do better than that. We can do better than that we really need, I would like to see in the future because we are going to need a considerable infusion of money to get this thing going, to stretch out the perinatal period, educate enough midwives to do it, nurses and otherwise, and so that we can have a much larger experience base. And I look at hospice, and I don't know, maybe it's just because they're all elderly men in the United States government that they latched right on to that. But it's also because Medicare is a single payer for the senior citizens across the board. So if we could have a single payer for the period before, during, and after birth and the care of the child, to put that into a package, and look at the cost, and now that we have the capacity to do the long-term studies to see what it does. I think if we don't do some things like that, that we are on the road to disaster as a civilization.
If all Medicaid births were served on the model that we have developed, the birth center model, it could save $2 billion a year. Now, with that $2 billion, what we have to do is convince the Congress or the CMS that we deserve to have that $2 billion, and we could solve that problem that you just raised. Yeah.
But we got to get the mothers. We got to do more than just empower the mothers about their birth. We got to make activists out of them, because if we don't get a real political movement going on from women, there are so many things. Women are just being abused. When you look at the rest of the world, and a woman has a baby and she has 6 months to a year off with pay. Those countries care about supporting the development of the family. We don't.
You know, one of the things that impressed me after I made a study tour in France in the early 90s, and it was that study tour that motivated me to add early childhood development to the services at the Family Health and Birth Center. But one of the things that really impressed me was what the French call their system. They call their system protection maternelle et infantile, protection of mothers and infants, not as we do aid to and assistance for and that sort of thing, but it puts the mother and the baby first, and it does that through that name that it gives. And if we could only change the name, we would maybe change some minds.
Let's work on that.
Yeah, that's a good one. I think the thing that I find when I talk about it in groups, the thing that motivates people is the story about Carol Ambers, who was about 17 or 18 when she gave birth at the Childbearing Center of Morris Heights. And we did a film on this, and it's all about empowerment. And I had not seen that there would be empowerment when we went to the Bronx. We were just trying to make sure that low-income people had the same opportunities for birth and early parenting and so forth that the middle class had. But when she was not scripted, and when she was asked what this meant to her, she said, you know, if you've given birth, then you've given life. And if you've given life, you can do anything. You can get a job, and you can go to school, and you can do anything you want as long as you put your mind to it. And that, she said, I think is the best thing about the birth center. It empowers women, and they in turn empower their families, and the families empower the community. So we're looking at the possibility of real social change in this country, which originates in the birth center and in the hearts and souls of the midwives that are being produced.
Yeah, that was in Hope Reborn.
Mm-hmm.
Very powerful from that young woman. And then there's Cheryl Feldman that came after and visited the Bronx. Penny Armstrong sent her there to visit. And she made the statement in a letter to Penny afterwards and said, what strikes me is that it's not just the birth center and empowering the women. She said there is a sense of building a community. And she said, and the time and energy of the women are not wasted. You know, they're all used in the program of care where they do become empowered. And she said and so it has exactly what you're saying, the potential for social change in the direction that we are running out of time to go in, frankly.
Yeah, I wanted to emphasize the necessity of understanding the cultures of the people we're trying to serve, especially as our population becomes more multicultural. And I think that one of the examples I can give for that, again, comes from the Bronx. And in the Bronx, there were some Muslim families that came to use the birth center. These Muslim families had a custom, and the custom was for the family to assemble, the whole extended family to assemble, and pass the baby from one to the other, whispering the words of Allah into the baby's ears. Really impressed me. It impressed families tremendously, but it impressed me that we were able to do this. And I thought to myself about the differences between birth centers and hospitals, and this could never happen in a hospital. It could just never be. So that's another benefit, I think, of being a midwife, being able to make that cultural investment, you know, in the people that you're serving, so that they want to do the things that you suggest. Of course, it has to be carefully done, because some of us have the idea that if we could just get our clients to accept our culture, they'd be a lot better off. But that's not the way to go. It's to recognize that they have a difference in culture, but they've survived this far. They have families. We need to learn a little more about we need to listen to the families.